Welcome to Dr. Balaga's podcast for the Curious Doc. Today is July 25th, 2026. This video is on an article recently accepted to JACC online on 23rd July 26. That's 2 days ago. Titled Management of Heart Failure with Preserved Ejection Fraction. A 2026 ACC Expert Consensus Decision Pathway. The lead author is Dr. Michelle Kittleson. And there are outstanding authors of repute on this report from the American College of Cardiology. Diagnosis of HFpEF. How is HFpEF defined? It includes heart failure signs and symptoms, a left ventricular ejection fraction equal to or greater than 50%, and objective evidence of structural and functional cardiac abnormalities. Main diagnostic challenge: no single definitive test. Integrate clinical findings, imaging, and biomarkers. Role of natriuretic peptides. Supposed diagnosis and prognosis, but normal levels do not exclude HFpEF. Recommended approach: confirm symptoms, assess congestion, and use heart failure scores, echocardiography, and natriuretic peptides. When to refer to cardiology: when the diagnosis is uncertain or advanced therapies or comorbidity management are needed. Diagnostic scores and mimics. Which scores help? H2FPEF, HFpEF, and HFpEF ABA. When is additional testing needed? When there is intermediate or discordant scores warrants further evaluation. Key cardiac mimics: cardiac valvular disease, cardiomyopathies, pericardial disease, and coronary artery disease. Key non-cardiac mimics: lung disease, CKD, obesity, anemia, and deconditioning. Why identify mimics? Treating the underlying disorder avoids inappropriate heart failure therapy. Optimal medical therapy: first-line pharmacologic therapy, SGLT2 inhibitors are the first line. Benefits of MRAs: they reduce heart failure hospitalizations and improve symptoms. MRAs are mineralocorticoid receptor antagonists. What about the role of ARBs and ARNIs? May reduce heart failure hospitalization in selected patients. Role of diuretics: relieves congestion and symptoms. How should therapy begin? Start low, titrate gradually, monitor kidney function and volume. Non-pharmacologic management: does exercise help? Yes. Improves exercise capacity and quality of life. Role of weight loss: improves symptoms, exercise capacity, and comorbidities. Device therapy: no proven routine benefit outside selected settings. Lifestyle priorities: exercise, weight management, and sleep optimization. What about the role of cardiac rehab? Appropriate referral may improve functional status. Comorbidities and practice pearls. Major comorbidities include hypertension, obesity, diabetes, AFib, CKD, and coronary artery disease. What's the goal of controlling blood pressure? The goal is to optimize blood pressure to reduce symptoms and hospitalization. What about AFib management? Rate and rhythm control and anticoagulation should be pursued when indicated. Goal of comorbidity management: improve quality of life and slow progression. The key clinical pearl: treat HFpEF using a structured phenotype guided approach. This is an infographic on this outstanding white paper authored by Dr. Michelle Kittleson and co-authors. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.